Good afternoon, everyone. So this is the webinar for today. So my name is Jiang. I will be the moderator for today. I'm an associate professor at the Department of Mathematical and Statistical Sciences at University of Alberta. I'm also a member of the 2025 class of the COPSS Leader Academy. Now I want to provide a little bit background about COPSS. COPSS is the Committee of Presidents of Statistical Societies. COPSS is made up of different statistical societies, including ASA, ENAR, WINAR, IMS, the Statistical Society of Canada, along with many friends of societies from across the globe. COPSS bestows many awards each year, including the new COPSS Leadership Academy, which is recently renamed to the COPSS Emerging Leader Award. The purpose of this award is to recognize early career statistical scientists who show evidence of and the potential for leadership. It also provides a mechanism for us to share our vision of leadership with the field. From this emerges this webinar series, which is also organized by COPSS and our wonderful partners at the National Institute of Statistical Sciences. These webinars are an opportunity to feature leaders throughout the field, inviting them to tell their leadership stories and share their insights. This is also an opportunity to celebrate statisticians and data scientists who have achieved great things and who have inspired others in many different ways. And then the topic for today is from asymptotics to action, how statistics should lead in the AI era. So we have heard people keep saying that there's a two-way street between statistics and AI. On one hand, AI gives us many powerful tools that can potentially accelerate our statistical discoveries. On the other hand, statistics also provide the guarantees. So we have good design, uncertainty quantification, and causal reasoning that can make AI more trustworthy and reliable in practice. So we will be attending this discussion and to hear our panelists' opinion in terms of where and how should statistics lead in the era of AI. So we are very fortunate to have two panelists joining us here who are remarkable leaders at the intersection of statistics, AI, and data-driven health research. Before we begin, let me briefly introduce these two panelists. So first, we have Dr. Annie Chu, who is a professor in the Department of Statistics and Applied Probability at the University of California, Santa Barbara, starting very recently, July 2025. She has previously served as Chandler's professor at UC Irvine and data science founder professor of statistics at University of Illinois at Urbana-Champaign. Her research focuses on statistical learning for large, unstructured, and heterogeneous data with applications ranging from text analysis and recommendation system to biomedical and social science. She's a fellow of IMS, ASA, and AAAS, an NSF Career Award recipient, and currently serves as the co-editor of JASA Theory and Methods. And our second panelist is Dr. Tianxi Cai, who is a Jiang Rock Professor of Population and Translational Data Science in the Department of Biostatistics at Harvard. Her work focuses on biomarker evaluation, predictive modeling, high-dimensional inference, and personalized medicine, with major contributions to bridging clinical research data and genomic science through scalable informatics frameworks. So both of our panelists have achieved a lot of awards and honors. I don't have time to actually cover everything, but I encourage everyone to explore their impressive bios. Okay, so now is today's event, and then I will briefly introduce the structure of today. So we will have each panelist talk about their own leadership journey of 10 minutes each. And then I will I have some prepared questions for them during the discussion. And then finally, we will open it up to the audience. So now let's welcome our first panelist, Anishi, to share her journey with us.
Okay, let me do the full screen. So if I move forward, can you see the next page?
Yeah.
Okay,
Yeah.
great. Okay, so thank you, Bei, for the invitation. And I'm also very glad to being joint panelist with Tianxi Cai. I still remember in 1999, both Tianxi and I was among the NISS Student Award. I don't know if Tianxi still remember that. So very happy to see each other again through the webinar. So today I'm actually talking about my journey, just like give my own experience. What is my journey from the asymptotics to the action of AI. So give you a little bit background about myself. I received my PhD from Penn State, and I have two great mentor and advisor, Bruce G. Lindsay and Dr. Bing Li. So I graduated in 1998, and I want to talk my thesis about quadratic inference function, try to improve generalized estimating equation. So I will mention the asymptotics for my thesis. Actually, is very standard. I mean, at this point, I'm thinking about it's very standard and classic. However, I also noticed the impact is big. Just give you some examples. The quadratic inference function software has been downloaded over 17,000 since 2019. This also Peter and his team put all this in R and SAS. So in 1999, I started my first academia job at Oregon State. But this job is very unique, that I have 1/3 of my effort was to provide statistical consulting for agricultural researchers. So remember, Oregon State is a very ag school. So during this time, I actually learned a lot. I do a lot of SAS coding. I learned a lot of even like a different type of the cows, like a Holstein, JZ cow. I learned a lot of their terminology, and I really enjoyed my time at Oregon State. So in 2008, I moved to UIUC. I know UIUC is very strong in computer science and also engineering. So I remember in the very cold winter days, I walked to the computer science building, talked to their faculty. I really tried to understand what they are working. But I quickly noticed that they have a huge team, like a very successful computer science professor. Usually they have 30 graduate students, PhD students working with them, and they can do things really fast. And they know what the cutting edge problems they want to solve. And they have a strong connection with the industry. So I actually learned a lot from this researcher at UIUC. During that time, I was particularly interested in text mining and also imaging data. As if I want to do text mining, I want to get the real data, especially, let's say, clinical notes data from the hospital. And during that time, the Mayo Clinic has a collaboration with the UIUC. I try very hard every year. I approach Mayo Clinic. I say, can I access your clinical notes? The answer is always no. Say they need to protect their patients. They have 5 walls. So I was very unsuccessful getting the clinical notes from any hospital, including Mayo. But the image data, I was pretty lucky. I was able to, I took initiative to contact Professor Stephen Bopart, and he's very successful doing optical imaging. He's a bioengineering professor at UIUC. So he was very generous to share his data. And from that point of view, I started to do some work related to the tensor decomposition. Eventually, we also involved the deep learning. So I want to talk a little bit about my journey to the data science. That during that time, I also collaborated with Institute Genomic Biology faculty. So even now, I'm still collaborating with Professor Derek and Professor Udong. Actually, all of us left UIUC. They moved to University of South Florida. I moved to UC Irvine and now UCSB. But our collaboration is still going on. So I was very interested in their research area, especially like investigate the trauma, how the trauma changed our DNA methylation, and how the DNA methylation different heterogeneous way to affect the PTSD disease development. So this work, we actually collaborate probably about even 10 papers together. This is like a 10 years work still supported by NIH. And I also collaborate with a breast cancer surgeon at a Cal hospital. So I really want to work with the people working the front line. I want to know what the area, what the topics they really care. So I feel this kind of collaboration is very, very useful. They don't know much about the statistics, but some of them, they're very sharp. They know the scientific problems and we click well, okay? And also during that time, I was Illinois Statistics Office, which is a consulting center. I was a director there. This is quite a unique ISO. It's like a self-support. That means if we don't make money ourselves for this consulting center, we have to pretty much close it, right? The university or department is not going to support us. So I remember like during one night, I was panicked. It's like running business yourself. I say, this few months, we didn't do that well. If we keep running this way, we're going to run into deficit. So but in some sense, I feel the panic, nervous, or the crisis is also good, push me out of my comfort zone. And I just think hard. I say, which connection I can get, which company I can approach. So I took a lot of initiative. I contacted several companies. I said, can we do this contract work for you? We run the consulting center. Look, our students' rate is not that expensive. So I was successful to get some contracts. And I was happy to say that when I left the UIUC, I still generate a plus money for the center. So I think during all this experience, I encountered many interesting real data problems. I would say this time is already doing the data science. We work with a Pace bus company in Chicago. That means entire Chicago, the bus data, we actually analyze them. We can tell them in which time of the day your passenger, how many number of passengers, if this bus is really not running efficiently or this bus really should have cut off. All these questions we need to address. Also, I feel like as a statistician, we should always think about what other scientists or what other clinicians, they really care. It's not just the problem you're interested in, you also try to solve their problems. So during the UIUC, I also started to develop a new course on data science and machine learning. This is a very unique course in a sense. It's not very traditional machine learning course. I actually have several topics. So that time I work on recommender system, text mining, but I didn't work on imaging data or network data, but I was also interested in this direction. I started to work on this. So I also approached like a Hong-Tu and Ji-Tu and some experts in the imaging or network data, even text mining. And I asked them share their course slides and I studied them. I self-taught myself a lot of things. And so I developed this course. And this course is more like I run these topics, and in the end, I told students it's a freestyle. That means they can do whatever projects they want, but it has to have a data. Okay, so that's a key component. It's not a simple toy example data. It's a real data, and it's a complicated data. Then in 2017, I noticed this is like a second time I run this course. I noticed that 1/3 of my students are doing deep learning. And that time I don't know much. I know deep learning, but I didn't know deep learning myself a lot. I said, I need to put this in my course material as well. So I learned the deep learning, and also I learned a lot of optimization tools. So I modified my courses and put this new material in this course. And currently I'm still running this course. Now I also add a transformer, large language model, generative model, all this topic students are very interested in learning. Okay. Another message I learned that the best way to learn something new is try to develop a new course and teach it yourself. And when you teach it, you have to really know really well. Otherwise, how can you teach it, right? So recently I just visited UIUC again. I was very happy that they continued to teach this course even after I left. So this is my junior at the UIUC. So 2020 January, I moved to UC Irvine. Then quickly, I noticed pandemic hit, okay? And that during that time, almost everyone was super aware of their health. I myself, like I measure my body weight daily. I try to also figure out how to battle this new virus. Then by chance, I heard someone talking about the mobile health, the wearable device. So I was immediately drawn this type of a research. I contacted school of nursing faculty and ask them what kind of research, what kind of data. So this is something like my current research on mobile health. We're using this smart ring and also the mobile platform to collect both subjective and objective information. So we are able to track their sleep, their stress, your heart rate variability, and physical activity. And around this line, we are also interested to do the continuous glucose monitoring. So this is another type of line. We're using this wearable device to try to learn how people react. Let's say you have a morning, you ate extra, or during the snack, you ate some extra. What happened to your glucose level? So, Bei, do I running out of time? I see a lot of message here.
I think Annie, yeah, we'll have time
Okay.
for you to finish.
Okay, so let me quickly wrap up. I skipped the detail. I would say during this journey, I noticed that data is very, very important. Like you need to really be very resourceful to get the data. So I mentioned that you see we have a EHR data, and currently we also collect our own data. And I want to connect previously I mentioned I wasn't able to successfully get to this clinical notes data. And when I had UCOI, I was able to collaborate with the CHOC, Children's Hospital of Orange County. And finally, I was able to access all the clinical note data for the mental health among the children. So I feel like I was ready for 10 years, finally able to get this data. Okay, so my current journey to UC Santa Barbara, we are going to establish a new center on statistic foundation for AI. So try to build a strong research collaboration among the California, like Santa Barbara, Irvine, LA, even Veteran Affairs. So we really try to solve fundamental problems ordinary people really care, like obesity, diabetes, aging, dementia, Alzheimer's, how to manage stress. Okay, so in general, we try to make an impact. So I want to mention this, that we also developed the app in the Apple Store. You can download this app in the Apple Store. This actually, you can track your daily emotion and well-being. And currently, we are collecting both subject data and object data called the UCI SMILES project. So I end here, Bei, yeah.
Great. Thank you, Dr. Chu. Dr. Tsai, your turn to. Thank you for so much, Dr. Chu, for sharing your journey, and Dr. Tsai, your turn.
So I don't have any slides. I'm actually always inspired by Annie's work and also her very enthusiastic sort of approach to science. I have to admit that I'm much less motivated in a way that I want to learn. I cannot make myself teach a course, but I want to share a little bit about my own journey. I graduated from Harvard with a PhD in biostatistics in 1999. I have to admit that at that point, biostatistics or numbers to me were just numbers because I was a math major. And at that time, I grew up in China. We didn't have too much opportunity to really do, for example, public health research. So to me, the research data really just look like numbers to me. I also didn't know what I want to do. I thought of getting another PhD, except that I thought it was too long. So my colleague actually suggested, why don't you just try being a faculty, see what happens. So that's how I went to UW in Seattle. I was very fortunate to have worked with Margaret Pepe, one of my favorite people. Working with her, I learned a bit more about biomarkers, think about like diagnosis, risk prediction, so get me a little bit closer to like a real world problems. But I returned to Boston in I think it was around 2000, and in early 2000, I remember it was around 2004. I was very fortunate to have taken a trip with happened to be with a bunch of fundraising people to visit Botswana. So that's the first time I visited a country where AIDS pandemic, the impact of which was still huge. So there was a Harvard AIDS Institute there, and Mark Essex was my collaborator who invited me to go. And I listened to presentations by the clinicians, many of which actually were physicians at Brigham. And they flew over there. It was like 28 hours to fly there every couple of weeks or months to teach them how to perform certain surgeries and also show us how they really translate research findings. For example, mother-to-child transmission, they should treat mothers during pregnancy to lower the infection rate, for example, transmission rate. And I also listened to presentations by their health minister. He said he literally went to funeral every weekend until this happened. It really touched me greatly. It's the first time I realized public health does matter and research does matter. So after I returned back to Boston, I was also very fortunate to have a great mentor, Professor L.J. Wei. He introduced me to a group of scientists at Mass General Brigham now working on EHR. So that's how I got introduced to EHR. And at the time, my research was primarily focusing on precision medicine. I also did a bit of research on genetics. At that time was very exciting and interesting, and I was trying to learn. But EHR at the time to me was just a big database. And I went in because I thought, oh, this is great. I have so much data. I can do, personalized treatment selection, all this exciting research, until I realized how messy data was. And I remember in the early days, I spent most of my time trying to understand what those data mean. And I was very fortunate to have a postdoc who, Shan Yu, he was trained more like an engineer. So we couldn't really process the text data. I had no idea how it works, how to do it. Because he was trained more like engineer, he just wrote software himself. And that totally changed my mentality because we couldn't get help from computer scientists to give us the data. We literally waited for 6 months to get any data. So that's when I decided that maybe we should touch the data ourselves. We should learn, where did the data come from? How can I organize the data? And how can that turn into the final research? So I spent the next, I would say, 20 years focusing primarily on EHR data for research. As I mentioned, I don't have as strong of a drive as Annie did, but I also really enjoy working with my students. They're so smart and they teach me so much. So instead of teaching a course, I work with my students. So I learned large language model, I learned transformer. I also learned a lot of the natural language processing tools and methods. So I think also because of the project with EHR, I actually, that was a national network, and we were put together with a team of computer scientists, informatics people, that deals with data management, clinician who has a bunch of clinical questions we're interested, and also statistician. So that's sort of became sort of the way I see how we can potentially benefit from team science. And because I sit with them every week, I talk to them all the time. I still, in fact, still work with many of them for 20 years. So that's when I also feel that maybe we as, I wouldn't necessarily say statistics alone is necessarily the key part of AI, but I think statisticians can be key part of AI. I think we should welcome the challenge that we face in front of us. We shouldn't say that the data, the messiness data is not our problem, because if it's not your problem, you will be on the passenger side. You'll have to wait till someone else pass you the data. So I think that really working with my students and also, our clinical colleagues really changed my mentality. I felt like being a good partner, right? To really care about the clinical questions, like Annie said, there are many clinical questions that like a lot of time actually arise from just random chatting, like they saw some patient or, they're just curious about it. So I think also during pandemic, that was also one of the first time I realized how important it is to work as a team. So we actually initiated a consortium together with colleagues from Harvard DBMI in the medical school to study COVID across many institutions. I think it's like over 300 hospitals in 7 different countries. And we work together as a team. Every week we talk about, what are the findings from what we see from the EHR data. So I think those experiences really helped me to appreciate a lot about both team science and also like if we are not afraid of the problem themselves, we as statisticians do have a sort of unique view of the data and the problem. But I think being able to really speak each other's language, to be able to just like not be afraid of the challenge. I really admire Annie thinking about even collecting data yourself, right? Why not? I always think that, why not me? Not because I think I'm better, just because I don't think that's a problem that necessarily is not part of our job. I think as you see, all the issues, all the problems arise from the modern data. And I would say exactly like Bei, you mentioned earlier, with AI, it does help us greatly to handle the complexity of the data, right? Annie already mentioned that, imaging, if you think about voice, right? And recently I spent a lot of time also working on, for example, network data and very messy data. But with all the tools and with all the methods, I think it's much less scary to us. It doesn't have to be a nice spreadsheet in front of us for us to analyze. So I think in conclusion, I would say that, many of the points Annie already mentioned, that really, be willing to learn and be curious and really care about the problem, not just because it matters to clinician. I feel like we probably really should be a scientist before a data scientist to think about what science that we really care about.
Okay, thank you so much, Dr. Tsai, and also Annie again for sharing your journeys with us. Actually, that brings us to our first question. So you have both mentioned how you carry out research. Now, because of the size of the problem, because of the model aspect of this data science, do you think, and also the AI tools are more powerful than before, data are messier. We have to deal with not just the tabular data, but now data like EHR data set and imaging network data set, which are more complex than before. So do you think that this has shifted how statisticians do statistical research? Now we have to work with a team. So what defines statistics? So I would like to hear your thoughts on that. Dr. Chu?
Okay, thank you. Excellent question. I thought about this, and I think sometimes we always try very hard to say, what is the identity, right? We worry too much, like what is the identity? I'll just let you know, if what we're doing is very, very important for others, we shouldn't worry that much. Doesn't matter we're doing, let's say, asymptotics, we're doing design, Are we doing just purely like even doing the data analysis? It doesn't matter. You publish paper in Statistical Journal, you publish paper, let's say in Nature Medicine, Nature Communication, Nature Genetics, this kind of journal, it's all good. Like we make a good use of our knowledge. That's the most important. So we shouldn't just be very rigid and say, oh, statistics. We have to do, let's say, using MLE, using, now, of course, later we talk about machine learning. We have to do this kind of a regularization. No, we just make ourselves too narrow. I think in a sense, we need to embrace a lot more broader sense what is statistics, right? Statistics, you think about, it's all about the data. The tools, all things we develop, they are tools. We try to make good use, of our tool to analyze the data, which is interpretable, which is making sense, reliable modeling. So in a sense that, actually I also answer Zheng Ke's question that how we do the balance, right? So of course, we need to address their question. On the other hand, we are not, we different from, computer scientists. We also think something deep, okay? We not just say, okay, this algorithm works for your current data, but we don't understand why. We have to understand why it works, in what situation works. I think this actually make a very unique position of a statistics. We not just, let's say, ad hoc, get a result, that's it, move on. No, we also try to understand the why. And then we can use statistical thinking and the concept to explain this in this situation works well. What's the asymptotic theory? What is convergence bound? How accurate of our result? Yeah.
Yeah, just following up on Annie's point, also related to Zheng Ke's question. For example, oftentimes I feel like I work with a lot of different collaborators, including Andrew here, who are expert in theoretical analysis, certain aspects. So I would say I'm usually interested in both. I really think you have to have the curiosity, not just because you want to publish paper, you want to be famous, you want to, like, if you really care, like if you're really curious about something, I usually go both ways, like top down and bottom up. I want a method to work. So it doesn't matter how beautiful your theory is, if it doesn't work at all, you have to like find the right example to make it work. That's already a bad sign, because I really think it should work. So that's a great thing about like what computer scientists do. They solve real world problems and they solve it. So I think we should also solve them, right? It doesn't matter which laws, which algorithm we are using, but we should solve the problem for the society. But on the other hand, I really appreciate talking to more theoretically oriented folks to really understand why. How did you use the information? Where did the information come from? How do we generalize? When does it fail? So I think we probably should think a little bit sort of outside of like, how do I balance, etc. Think about what makes you excited about it and what are your strengths, right? So that you will find that eventually things converge. And I really appreciate many of the collaborations I've had. I feel like I learned so much from talking to different people and getting different intuition.
Okay, thank you, Dr. Chi, Dr. Tsai. So our second question for you today is about some practical suggestions. So for example, you have mentioned that you have worked with domain experts to collect the data, to understand the engineering side of the data science, to see how the raw data is being processed. So probably among this process, what statistician can contribute is the design and certain quantification and causality, which should be embedded at every single step of this process. But the practical question is, if we are to tackle these new challenges that AI era brings to us, how do we get started? So for example, that also what does that imply for education and curriculum? So then we can prepare students to tackle those new challenges. Do you have any suggestions how we can like work on the curriculum, changing the curriculum, changing our mindset in terms of what should we learn in this new year. Annie mentioned that you taught a new course, but I would like to hear more of your suggestions in terms of how we get started.
Okay, thank you, Bei, for the excellent question. I think I really agree with Tianxi about the curiosity, that without curiosity or without passion, we will not do good research. So that's first thing, like for each individual, we all have a different strengths. You have to ask about yourself, what things you care about most. I also ask a student when I work with PhD student, each of them may do very different thesis topic. I will ask them, which topic are you really, really, really interested? I said, I don't want to impose any topics I'm interested. I want to know which topics you're interested in. And besides the statistic problem, they say, oh, I like to do causal. I like to do network data. That I think beyond that, the more like a research statistic topic, but what is the domain science area you're interested in? So if you really like someone really care about diabetes, glucose tracking, then I say we can do this type of data. So it's a similar like answer your question, like how can we get started? We'll first ask ourselves, what things you care about most? What things you feel it's your strengths you can contribute to? Then I think you maybe already have the collaborator with you. How could you build on this collaboration, continue on this sort of action to do more AI-driven research? In fact, I'm actually aware of many areas, even like a business, marketing, even accounting, they want to do the AI tool to improve their field. Right. So it's not just like a medical, it's even sociology, political science. They embrace this AI tool, try to do new research. So if you really care about a certain research direction, discuss with them. And also, of course, you need to do a lot of literature search, what are available tools, and get students involved. And I think this is a good starting point.
Yeah, I also want to just rewind a little bit. I feel like, a lot of time we as statisticians somehow need to justify our existence or our importance. Like, what do we, like, what are our unique contribution? And oftentimes we land on uncertainty quantification, causal modeling, right? I feel like I don't actually think that way. I just feel like if we should all view ourselves as for so-called data scientists, I actually really like this term. There's a problem in front of us, right? We all have different mentality, we have different training. We can also develop a machine learning or statistical learning algorithm. So I don't think we should necessarily frame ourselves and define us. Then we do what we want to do, right? Just say, what are you interested in? Just do it. And in the process, you will soon learn what you really care about. And, as I mentioned, I really benefit so much from collaborating with many different kind of people. We all, like we, meaning like our statistical community as a whole, we have so much strength in so many ways. I don't believe that's only about asymptotics or about like uncertainty quantification. We also can design a loss function. We can design and understand how do we frame the question from the very beginning of scientific question, given all the tools we currently have. What is sort of the algorithm of the, including the loss function, how we use the data to get an answer, right? I don't distinguish myself from, another machine learning person or another, informatics person. I work on informatics problem as well. So to your question, for example, how do we get started? I would say there's so much data out there. You can get a lot of, for example, we wrote many tutorials, and I know Hongtu and many other people, including Annie, help to put together a lot of resources for people to really go and learn. Even ask ChatGPT. I ask it all the time. There are things that I don't know. I just ask, and they're getting better and better. So I feel like I learn with them. I actually don't mind at all asking a question, but I don't just copy it. Of course, I will click the link, try to learn. So I don't think we need to narrowly define ourselves just as someone who's good at syntactics or good at causal modeling.
So this is there's a question in the Q&A which is related. So I will probably ask you now. So for example, if we want to learn large language model or in particular transformers, do you think that's something that statisticians will be comfortable with doing? And if we want to learn, do you have any recommendations? Since Annie mentioned that she included transformer in her class notes.
Yeah, actually, there are a lot of online material. I mean, of course, you can do some conference to do a short course, but there's so much material online. And there's the YouTube, they have a slides. And actually, we shouldn't be afraid about, let's say, deep learning, large language model. Fundamentally, a lot of these tools, we are already very familiar. Like for example, we call the plus function, they call the rule function. They change a lot of the terminology. And we do a lot of regularization, right? The penalty function, they also do this in the attention mechanism. It's all like, but of course, they have to much bigger scale. We shouldn't say, oh, you just same as what, no, we shouldn't say that. So a lot of things are conceptually very similar, but how they execute it is a much larger scale. If you in statistical traditional way, we're not able to handle such a large scale. So we also learned that engineering side, they're able to really train so many billions of parameters. Like in the statistical older way, we are not able to do that. So acknowledge that how their strengths as well. Another thing I really try to echo what Tianxi said, that we shouldn't always predefine ourselves and say, oh, we can do causal, that's our strength. I want to tell you, political science people, also econ, even engineering, computer science, a lot of them do causal as well. So it's not only our specialty. So we do uncertainty quantification, we can do inference, they can do as well. So shouldn't kind of restrict ourselves, can only do this. Now, this actually reminds me in the early on when I was at UIUC, we were very excited to change the name of a department. I was a lead, they put me as a chair for the task force, changing the name to be statistic from statistic to statistics and data science. In the end, the dean just said the one sentence. He said, your department's doing really well as a statistics. So why do you want to change the name? Say computer science, they don't change their name. They always call computer science. Okay, do you get it? You have this confidence. They don't always worry about, we don't fit in, fit this, fit in that. We should have a confidence. We are very, very good at solving a lot of problems. So that way, I think we can make a lot of things much broader, not just restrict ourselves only to these things only. Okay.
Yeah, I also want to just answer the question Candace mentioned that how do we go about convincing collaborators of statistician value in AI? I would say at least my own collaborators, they definitely value and they don't view me as just a statistician. So that's why I kept saying, I don't think we should predefine ourselves and put a hat, and that's the only thing we do. If you can solve their problems, they will love you. It doesn't matter what tool you are using. You are answering a very important question. You have all the tools, you work with them. They don't actually, a lot of my own collaborators, they're clinicians, they actually prefer to work with clinicians sometimes, statistician compared to computer scientists, because there's other aspect that we know their language a little bit better. For example, when you come to, talk about like cohort study, clinical trial, right? We still know that. So in that sense, I think they actually feel very comfortable working with us. So I don't think there's too much of convincing necessarily, but I really think that we should care about their actual scientific problem. You talk to them as their colleague, not talk to them as your statistician.
Mm-hmm. Yeah, since we are talking about how do we define ourselves, there's another very interesting question that comes up in the Q&A. So uh, could you offer any perspective on whether deep specialization is generally more advantageous for research career, or if there's growing value in researchers who can bridge these distinct domains? I think this is talking about interdisciplinary approach to tackle the problems. Um, on one hand, we probably want to understand a particular problem in some depth, but at the same time, I think we are if this is still in terms of very special. My understanding of the question is that whether we're working on general methodology versus a specialization in terms of particular problems. So whether how to balance these two if we're interested in pursuing a research career. So which direction should be focusing on?
Yeah, maybe Tianxi, you want to answer this. I think I sort of already addressed earlier, yeah, for this question.
Yeah, I still personally feel that you should have depth. If you only know things on the surface, there isn't it's much harder for you to make a very unique contribution. But I totally agree. There's so much, right, we need to know. But I feel like it depends on which stage of your career you are at, right? What you really are good at. If you are very deep, like you at least have in-depth knowledge about a domain, let's say, theoretical statistics, look at any, right? Should start from very theoretical aspect. But over time, you will learn, right? You will pick up other knowledges. But I think we do have sort of a change in our role or our need to communicate with other people in other domains. So I would say if I were to choose, I would choose to be very deep in one particular area, like statistics, but then I would try very hard to pick up the domain knowledge enough to communicate with them. So that I think, to just communicate, you can learn very quickly. You know enough over time that I think might be a better strategy. If you know a little bit of everything, but not deep enough, it's a bit hard to make very fundamental contributions.
Bei, I saw this question is quite interesting. You say, so far we talk about the collaboration rule, but we didn't talk about statistics in leading rule, which is not true. I noticed a lot of our statisticians actually work on this scientific question as a corresponding author. That means we are the one raise the scientific question ourselves. So like I know Tianxi and also Xi Hong and also Hong Tu and many other great statisticians, they are the corresponding author to publish in Nature, Science, and all the leading domain science journal. So I also recognize it. That's a change. In the old days, like I was usually in the middle author of the top journal in, let's say, in JAMA, this kind of journal. I'm in the middle author. I would never imagine I'm going to publish this type of journal as a corresponding author, but actually changed. Okay, I tell you why it changed, because if we not just restrict ourselves, only to sort of like develop a method, analyze the data, develop a theory. If we don't restrict ourselves, we are able to not just doing the collaborative role. We are the leader. So as what Tianxi mentioned, that we should always think first, we are scientists. We're not just like a statistician. Statisticians want our expertise, but fundamentally, we are the scientists. We are solving the problems. People care. We raise a question. So often I raise a question. They say, it's great. We haven't thought about it. Okay. So even that domain science, I threw my direction. I said, I think this question, I really care. Then they got excited. So I really think about, we not just only solve the problem, we also ask a good question, good problems. So what problems we want to solve? Yeah.
Yeah, I really like Dr. Chu, Dr. Tsai's suggestion in terms of we should change our mindset. We're not just a supporting role. We should be the driving force of every research development. Yeah, I really like that. And also, Dr. Tsai mentioned that a lot of statisticians are nowadays being the corresponding author on many scientific journals. Yeah, so let's move on to our next prepared question. So you both have already touched on that, but I still like to hear your opinion in terms of what specific area? So you have mentioned that we don't necessarily be the supporting role, but so quantification we are more than so design, uncertainty quantification, causality. We have more strengths than just these three aspects. But what do you think the priorities or areas that we should be focusing on in order to make bigger impacts? So those are our strengths. I think design, causality, and uncertainty quantification are our strengths. But we could also work on other areas. So, what suggestion would you give?
Yeah, I think it really depends on one, your personal interest, and two, your strength, because I feel like we're still coming back to, who we are as statisticians. But if you just forget about the fact that we're a statistician, we're, one of the so-called data scientists, let's say, I think, some people are really interested in a particular domain knowledge, I have a former student like Jennifer Sina. She probably knows so much about prostate cancer. She can talk to you about it for like a day. So she cares. That's a domain. So I don't think we as statisticians will only be the statistician. Just like Annie said, she will raise questions. I do too. I raise to my colleagues and say, why don't you look at that? I'm curious about this, right? So I feel like we don't have to keep thinking, okay, I'm a statistician. What can I do? Just think about, what do you care? Like, for example, I have spent the last 10 years at least understanding what are the messiness of EHR data. Why is it so hard for someone suddenly jump into EHR and do research? And we spend a lot of time actually creating like algorithm pipelines, software to help other people to analyze the data better. Because I care. I feel like this is limiting us as, some like without like informatics training to understand the data. But there's a lot of research we can do as well, not just like the tools. That should be because I care about it. I like it. So, but there are other, like Hong Tu did a lot of work in like imaging, linking imaging with genetics, and Shi Hong's similar, and Annie. They're like scientific questions they really care about, or even certain methods domain they really care about. So I feel like I really think that we should take a step back. Just think about, what do you want to do? What are you interested in? And then think about what expertise that you have to answer the question in what way.
Yeah. Yeah, so due to the time constraint, I would like to cover one interesting question from the Q&A, which is asking your perspective on how our statistics and the biostatistics curriculum should evolve to prepare the students for the new era of AI. Do you have any thoughts?
Yeah, this is an excellent question. First, I think we are all aware that our curriculum is kind of out of date, right? We teach them, which is still important, the foundation concept of statistics. But then these days, a lot of, just think about the homework question, even exam question, they ask ChatGPT, right? So we really need to rethink this traditional problem. The answer is already there. Is it really useful to train our students to learn all this? So in some sense, I think we need to fundamental I would tell students that ChatGPT can tell a lot of knowledge, but ChatGPT cannot tell you to be creative. Creative in a sense that you have a creative concept. You have a creative original way to solve a problem, right? So in that sense, I think we can, of course, train our students, let's say new tools, Python, deep learning, transformer large language model, many other things. But also, we also need to be aware to train our students. The world is changing. If you're not adaptive, if you know better than ChatGPT, why people need to hire you? Okay. So one of my students told me, one of my former students said, in the future, I really don't need the students to work with me. I said, why? He said, look, I got a GPT Pro can help me to do a lot of proofs and to do a lot of coding. And students not that great compared to ChatGPT. So this is a really identity crisis. We need to be worried. Are we better than GPT? Right? Is the faculty better than GPT? Professor, the students better than GPT? If we cannot live up that kind of expectation, we will be obsolete. It's not like a particular area we didn't learn or not learn, but you also need to think about this.
Yeah, this is also related to another question, which is related to a lot of the companies are now building agentic AI system. So the question is asking how the scientific community should respond to this kind of development, especially regarding the role of researchers when companies are developing AI agents that could potentially replace parts of the scientific process itself. How do you think scientists, since we're data scientists, should engage with or regulate this trend? Since a lot of the you already mentioned some aspect of that.
I just want to make one quick point because we recently just finished a study using AI agent to basically annotate a certain disease activity from clinical notes. And initially, there are two agents we developed. Another one is to look at like medication history over time. That's something if you do reinforcement learning, right? You need to know at what point what medication they're taking. And initially, I thought, that's so easy. So I told my postdoc, you should do it in 2 weeks. Come back to me. And it turns out to be so hard because the data itself is very noisy. Like sometimes you see conflicting information, for example. But long story short, the good news is that we noticed that we actually now proposing a so-called human agent co-learning system. So basically, having the agent greatly save our time, but it's not so smart. It will make mistakes, and also it makes subtle mistakes that's getting harder and harder to detect. So in that sense, I feel like I actually embrace the idea of having agent, but we kind of need to grow up with the agent. They're next to you, right? You have a good friend, you have a good RA next to you all the time. Then you will learn with them. You can't just keep asking them to replace what you do without moving ahead with them. As long as you are moving with them, you will basically evolve with them. So I don't feel I have a colleague at Stanford. He said he's developing AI professor. I was joking with him. You are gonna wipe us out. But at the same time, I feel like I just have a nice colleague who listens to me all the time. I can ask all kinds of questions. So I actually really like that.
Yeah, so someone asked, what human values do you think statisticians bring to the boardroom as an AI system cannot? I want to mention that Tianxi made a great, the noisy data. So AI is not really able to replace human. Particular, let's say we have very noisy data. We have a lot of heterogeneous. And GPT, just think about GPT's fundamental problem. It's like training a large data, then they can do well. But if you don't have enough data for this kind of training, they don't do well. They don't have information to train. So that comes to data heterogeneity and also the individualized modeling. I think we still have our strengths to develop, let's say, precision medicine, because precision medicine has to tailor different individuals like model and how to deal with the heterogeneity. Even currently, we're also working on the improved large language model, put a diversity. Like I always feel like so many cliche, like I want to generate a letter with a GPT to help. You can always tell this is a GPT letter and this is a human's letter, right? I try to see a lot of differences. So how can we improve large language model for the diversity, for tailor different individual writing style. Even this problem, if we can solve it, you can make a lot of money for that as well. So just always think about creative way. And also another thing, I was always have a business mindset. Like during my consulting experience, we also train ourselves as an entrepreneur, right? What things you think works, people like. I mean, of course, like you still work on the fundamental problem statistics, but also keep this in mind as well.
Mhm. Yeah, unfortunately, we have to stop here. It's already 11:01 for me. So, thank you so much, Dr. Qu, Dr. Cai, for sharing your insights and then the discussions. I'm sure a lot of you already found this conversation very helpful, but please feel free to share the recording with your colleagues. And here I want to give the special thank to many COPSS and National Statistical Sciences staff members who are behind the scene, and also Amita and Andrew are here. So thank you for making these events happen. And then so we have to stop here, but stay tuned for more events like this in future webinar series. Thank you again, everyone, for participating in the discussion, and then Dr. Qu, Dr. Cai again. Okay.
Thank
Thank
you.
you.
And thank you.
Bye.
Yeah.
Yeah.
See you soon, Tianxi. Bye-bye.
Thank you, everyone.